On this podcast, I'm going to be joined by one of the country's top cosmetic dermatology PAs. We're going to talk all about skincare, about injections, we'll talk about mewing, snail slime, and a whole lot more. But before we do that, I'd like to give a quick shout out to Walking and Talking. Walking and Talking left a nice review of this podcast on iTunes stating, Skin Health Plus. It's my favorite podcast about personal health. Well, thank you so much, Walking and Talking, for this nice review. And if you've been enjoying this podcast, if you could leave a rating or review on iTunes, it definitely helps me to spread the word. Okay, so today on this podcast, we're going to be joined by Amy Koberling. Amy Koberling is a cosmetic dermatology PA. She has a podcast called #Skinthusiast, and we're going to talk all about skincare. We're going to talk about the ideal skincare routine. She's going to go over the specific products that she recommends. We're going to talk about Botox. We'll talk about filler. We'll talk about trends in skincare like mewing, like snail slime, and a whole lot more. So let me introduce Amy Michaels Koberling. She is a cosmetic dermatology PA specializing in skincare, and she's the founder and creator of #Skinthusiast, a website, an online community, and a podcast dedicated to decoding the often confusing world of skincare. Trained by one of the country's most revered dermatologists, Amy set out to make quality, effective skincare accessible to everyone. On the daily, she is managing patients and prescribing personalized, efficacious skincare regimens while also creating educational and digestible skin and hair care content for the consumer. Amy speaks on expert panels, provides cosmeceutical lectures to other dermatology providers, has been featured as a skincare expert for beauty publications, and works with beauty and skincare brands across the country as a key opinion leader, KOL. It's her passion to educate the public on skincare, beauty, and wellness so that they can take actionable steps to feel their best selves. So I'm so excited to bring Amy Koberling to the Holistic Plastic Surgery Show. Let's get started. Thank you so much for joining me today, Amy.
Thank you so much for having me. I'm so excited.
So let's start because you are one of the most prominent cosmetic dermatology PAs in the country. You've got a ton of followers. You've got a podcast called the #Skinthusiast podcast. How did you go from PA school to where you are today?
That's such a great question, and I never imagined I would be here. In PA school, I knew I had an interest in dermatology, but I also did other clinical rotations. Obviously, I did the mandatory ones, but my electives were in things like cardiothoracic surgery. I did do a derm rotation as well. I knew eventually I wanted to end up in dermatology, but I also knew that coming out of PA school, I wanted to cement my medical knowledge first because it's a very short time. The program's only 24 months, and then you're just kind of out in the world. So I wanted a job that could really teach me a lot more about medicine. So I took a job in the intensive care unit with a great physician who taught me so much. It was a great group. It was very intense hours, very intense work. At night, I was the only provider in the hospital responding to, critical calls from the ICU. So there was a lot of responsibility, but I learned so much in a short time.
That was a
And
PA residency?
No, it was a job. It was my first
Oh, a
job.
job.
And
Okay.
he was actually kind of notorious for hiring people right out of school and training them. So obviously I had a training period. And then once I was actually on the floor myself, there was a time where I was only there during the day. So I was only there with the physician. And then once I was there for a while, I was then kind of on my own at night. But it was an incredible experience. And I really intended to do that for many more years. I was young. I had a lot of energy. I loved it. It was taxing, but I really, really was passionate about it. But again, I knew I always wanted to end up in dermatology. And basically my dream job in Miami with the dermatologist I've always wanted to work with opened up. And it was kind of like the clouds parted and this was the time. So I went and I haven't looked back, and I just kind of started educating about skincare online, and the rest is history.
So do you still work with that dermatologist today?
I do. I only see patients on Wednesdays now because
Wow, okay.
this takes up a lot of my time, but I also have a young daughter. She's about to turn 2. So it really affords me the ability to kind of be home with her and kind of work from home on the other things. And then I go into the office once a week for right now until she's a little bit older.
Well, that's exciting. I mean, I get a lot of people who email me. They'll call the office and they ask me, they're nurses or they're PAs, and they say, "How do I get in the cosmetic field?" And honestly, it's like I have 3 nurses and 1 PA. I have 1 esthetician and a medical assistant. And people are always asking, like, hey, I'm a nurse on the floor. Like, how do I get into that field? And I see people who take courses, they get certificates, and then they apply for a job and they go, oh, I'm a cosmetic injector, and they took a weekend course. I mean, what do you give? What type of advice do you give? Because I'm sure people are asking you all the time. The
Yeah.
situation that you're in now, there are probably PAs who would love to get into that. Like, I just tell them, look, unfortunately, you just have to get a job with somebody, and it's really learn on the job. I don't find that I give any preference if somebody has had a weekend course in injectables, because I can teach that to them in a week usually.
Yeah, exactly. I agree completely. I think it's all about right place, right time, getting
Hmm.
yourself out there, attending meetings. If you're in a primary care office, for instance, you learn about some of the acne medications from the reps. Try to ask those representatives, can I come to any dinners that you have with providers? Just try to get your foot in the door wherever you
Yeah.
can and meet people, because it's all about those jobs opening up. And yes, it is hard to find jobs who want to hire somebody without experience, but
Hmm.
there, I would argue, are equally as many jobs from dermatologists and plastic surgeons that almost want you to be green so they can train you the way they like you to inject and the way they like you to practice. I was really lucky that my dermatologist was so happy to have somebody who was kind of green in the field to train,
Yeah. Yeah.
and she really took me under her wing, and it was like a residency. It was just an incredible experience. So there's so much variation in the jobs in this field. There are some that are completely cosmetic, some that are half. The
Hmm.
balance is so different for everybody, and the situation is different for everybody. So I try to help people as much as I can with that question, but it really comes down to, where are you at in your life? Can you take the leap from the job you have right now? A lot of times it seems like the questions I get are from people who have been offered a job in dermatology, but it's maybe not their dream job, and they
Hmm.
don't feel like they really jive with the practice. And that's the hardest for me, because it could be that stepping stone to get you to the right place, but at the same time, nothing is worth it if it's going to cost you, your sanity or your integrity or any of that. So it's a case by case basis, but I think just getting yourself out there, meeting as many people as you can, learn what you can. But I agree with you that I don't think that the injectable courses are very helpful. um, Maybe it's nice to just show that you're very interested and you're willing to put in your own money behind your training. That might be a way to look at it, but I don't think that they're that helpful.
Yeah, and I tend to hire people too who are not necessarily out of school, but people who aren't necessarily in the cosmetic field, because just like you said, I do like to train them myself. And we start them, if they're going to be injectors, we start them with the easiest, which would be Botox. And then they do that for quite a while, then eventually get them into the fillers and all that type of stuff. But it's definitely a learning experience. And there is, I think, as a boss, as an employer, there is a benefit to picking somebody who hasn't, let's say, been working for a long, long time in the medical field. Because I have nurses that apply to work with me, and they say, oh, I'm 60 years old, I've been in the hospital for 30 years, and I really want to switch up. And it's like, yeah, I'm open to that, but then what they ask for pay is the pay of a nurse who's been working in a hospital for 30 years and has built up their income. But the problem is, they come into an office like mine, and being in the hospital for 30 years doesn't give you any, skills that are going to help with cosmetic injecting. And so you're kind of paying for somebody who has experience doing something that isn't necessarily applicable to what we're doing. And so it makes it difficult sometimes to try to hire somebody who has a lot of experience in the hospital and stuff, because what they're looking to get paid isn't commensurate with what they can unfortunately bring to an office, because they haven't been injecting people with Botox and fillers before.
Exactly. And that is kind of what I was alluding to when I said you have to think about where you're at in your career right now,
Yeah.
because I was young. I wasn't yet married when I switched. I didn't have any children. I could afford to take a little bit of a pay cut and then
Yeah.
work my way back up. But that's not the case for everybody. But to your point, it is something that you have to think about going into a new field, any new field.
Definitely. So a lot of people are going to be curious to hear our takes on skincare. We're going to talk about skincare first, and then we're going to talk about injectables. So let's start by talking about skincare and what on products and ingredients. So what right now are you hearing a lot of? We talk a lot about antioxidants like vitamin C, and people have been talking about retinol for many, many years. Is there anything that's outside of the norm, of the typical, that you've been hearing good things about, that, or that you've been seeing great results in your patients or your followers?
Yeah, I think for me, some of the most exciting that I've been asked about are things like peptides, exosomes. I
Hmm.
think, growth factors are exciting. I also think there's some excitement in things like delivery systems. We're going to be seeing a lot more talk about that. Maybe not necessarily the ingredients, but how we optimize those ingredients in the formulations. But I would say my patients coming to me, funny enough, I hear a lot of niacinamide and hyaluronic acid still, which I think
Hmm.
are just kind of, to me, are very standard. Like I would
Yeah,
almost put those in the same category as the others that you mentioned as far as how long they've been around, and
yeah.
they're kind of in everything already, but they have great PR, I guess. Everyone's
Hmm.
talking about it. But the ones that really excite me are things like exosomes and peptides and things like that.
Tell me a little bit about exosomes in skincare.
It's very interesting, and the research is still very early, but
Yeah.
basically you can think of exosomes as like almost little pockets that carry things, and they're used in various different formulations in various different ways, but it looks like they may have some benefit on things like anti-aging and collagen production and things like that. So to me, it's very exciting, but also super new. I think there's a lot of new ingredients coming out all the time. So for me, that's one of the ones I'm kind of willing to put my money behind and invest in a little bit more. But it's still new. I think we need to know a little bit more.
Yeah, there are a couple of newer companies now that are looking at exosomes in skincare. The concern with exosomes, and for me, I'm not sure, and maybe you have more information than I do, but with stem cells, the FDA really clamped down on them very recently, the last few years. Where it used to be there were practitioners here in the U.S. who were advertising stem cells for anything from hair to injecting into joints to there were plastic surgeons who were talking about stem cell facelifts and stem cell breast augmentation. And then the idea behind exosomes is essentially, the issue with stem cells is that these are cells that basically are so young that you inject them into or you put them into a body part. And the idea is that they become then cells of that body part.
Hmm.
Exosomes, the idea is that it's not necessarily the cells that you are using, but it is the cellular messengers that can necessarily start off with stem cells and then they create these cellular messengers. That's the idea behind exosomes. But my understanding is a lot of is the FDA has cracked down on those too as well. Have you heard much about that?
I haven't heard much, but it really doesn't surprise me, to be honest, because anytime we're talking about that unknown, especially when we're talking about stem cells, I think it
Hmm.
creates a lot of fear. So I think there is good reason for being a little skeptical about it, and kind of waiting until we have more data before we're willing. For me, I keep it to topicals. That's
Yeah.
kind of as far as I go with it.
Yeah, and there are people who are using stem cells like plant-derived stem cells in skincare products. I haven't seen a lot of that, but I know that and I don't know if that's more of a marketing thing than anything. Um, but yeah, definitely injection of stem cells now here in the United States is limited to you have to have like an IRB study and all of
Right.
that. So a lot of that now has moved overseas because so little of it can be done here.
Yeah.
Um, how about peptides? Interestingly, peptides essentially are combinations of amino acids. The way I describe peptides to my followers essentially is that peptides are kind of groups of amino acids that act as cellular messengers. Are there any specific benefits that you see in people who use peptides in their skincare?
Oh gosh, peptides. I feel like there could be an entire episode on peptides alone, because there's different kinds of
Yeah.
peptides. There
Are there
are
favorite ones of yours?
I don't know. I think our Geraldine is like a
Hmm.
really exciting one, because it's one of the ones that they call it Botox in a bottle because it acts on the acetylcholine at the neuromuscular junction, but it's not really Botox in a bottle. But it is exciting to me that it could potentially help soften some lines for somebody who maybe wants an adjunct to treatment or doesn't want to do it and wants to do everything they can. I think copper peptides are exciting as well,
Hmm.
for the anti-aging and collagen benefits. Peptides also are just great hydrators. So whenever I see it in a product, I'm like, okay, this is a little bit of a bonus for that product,
Yeah.
but it is becoming one of those things that we're seeing in everything.
Yeah.
And that's when I start to worry, the niacinamide and the hyaluronic acid, which is in every single product that you use. It starts to get a little redundant, and is it really necessary? And then the price tags go up on the products because they can say they have peptides. And that's a whole nother conversation, because just because it says peptides on the label really means absolutely nothing. There are plenty
Mhm.
that are useless.
Yeah, and it's interesting because I mean the way I look at peptides and I try to encourage people is I kind of look at it at different tiers. And I know you mentioned growth factors too. We'll talk a little bit about that. But the way I look at it is if you really are looking for the most kind of anti-aging punch, I would typically put retinol or retinoids at the top. and then probably the growth factors, and then I would put the peptides underneath that. But the benefit of peptides is that they're easy to get, and they're easy to tolerate. And so for people who don't want to spend a ton of money on, let's say, a growth factor cream, let's say they are sensitive to retinoids, then peptides could be a very reasonable budget alternative that really still can help improve the skin.
Yeah, absolutely. I would actually love to hear how you talk to your patients about growth factors and who you recommend them to, because I think a lot of these kind of get balled up into the same category, but they do have their differences. So who is your favorite patient to give growth factors to?
So there's when you're looking at skincare products with growth factors, I mean, you've got the Skin Medica, the TNS complex, which
TNS.
has been the one that's been around for a long time. And I was just talking actually with one of the reps the other day, and I was like, I never liked it because it smelled so bad.
And it's so
And
expensive.
and it's so expensive. And I think it's like 1 ounce or something, and you're paying like $200 or more. And so it was never something that I was really that fond of because of the price tag and because of the stench. Now, my understanding, it doesn't smell anymore, so that's good. And then there's a brand, Neocutis, that's been
Hmm.
around a long
Yeah.
time that really was growth factor based too. But there has been, at least in the past, there was question as far as where they get their growth factors from. Like, is it from foreskin?
Hmm.
And there's kind of like the controversy with all that. So I never really got too much into it because I didn't want to honestly dive into some of that controversy. And I saw such nice results in general with the retinoids, that it just wasn't something I got too much into.
That's so funny you say that because I have the same answer. I really didn't delve that deep into growth factors because, and this is how I feel about most of these ingredients. It's exciting to learn a little bit about them and maybe play with them in your routine. But at the end of the day, it's the sunscreen and the antioxidants and the retinoid that is going to be the most effective. So I find myself just always going back to that for myself and like when I'm educating.
So what are some of your favorite brands when you're looking at skincare that you recommend for your followers?
So I'm completely brand agnostic. So there's not a single brand on this planet that I have used every one of their products or would recommend every one of their products. I think the magic of skincare is when you cherry pick the best from all of them, the best for
Mm-hmm.
you from all of them. So when I make a regimen for a patient, there's usually no two products that are from the same brand. So
Oh, interesting.
there's so many good ones out there. I love SkinCeuticals. I love Skin Medica, like Sephora brands. I love Skin Fix, Dr. Dennis Gross, Shawnee Darden. There's a lot of skincare experts, professionals, dermatologists, estheticians that are making their own lines, and some of them are really fantastic and things that you wouldn't be able to get at a big box beauty retailer 10 years ago.
Mm-hmm.
So those are, I guess, some of my favorites, but it's really endless. There's so many brands I use and recommend. It's all about exactly what's in front of me, the concern, the patient,
So
their
let's try something,
motivation.
and I haven't warned you about this. Let's try something a little fun, okay?
Okay.
Let's say you've got, I'm just going to kind of make a generic listener of this podcast. They come into your office, or let's say they're listening right now. We'll say it's a Caucasian woman, because most of my followers are women, although some men. So if you're a guy listening, that's okay. That's cool. You're welcome here. Let's say it's a Caucasian female woman about the age of 40 years old. Overall, takes good care of her skin. If she tries to eat right, she exercises regularly. Let's say she has a full-time job as an accountant. She tries to avoid sun, but she loves, let's say she lives in a northern state, so she loves going south for the winter. She comes to see you because she's got some fine lines and wrinkles that she's starting to notice that she didn't notice when she was in her 20s. She's got some spotting, age spots slash sunspots, and she really has just been using um, cleanser that she's been buying, like Cetaphil cleanser, and let's say an Olay moisturizer that when you look at it doesn't really have any actives in it. And she says, look, I just want to slow down the aging process. I want to get radiant skin. Can you give me a basic skincare routine? Not a Korean 12-step skincare routine, but a basic
Yes.
skincare routine that she can do. And then what products would be a good product for her to start with?
Oh, this is exciting. So these are my favorite patients because I like to call them kind of skincare naive. And it's
Yes.
fun because they get to see the biggest change. So it's a little bit harder to see a change when you're someone who's been using the best skincare for years and you come to me, and that's more of a challenge. When I have someone like this that comes in and they're not using a retinoid, not using an antioxidant, an exfoliator, anything like that, it's really exciting.
And just
So
just as an aside, before you get into it, it's funny because I've lately with my book coming out, I've done these TV shows, and And I've had people like there's Dr. Jennifer Ashton, who's on Good Morning GMA3 and Tamron Hall. And we go through skincare and I say, you do this and you can look this many years younger. And I always look at them like, yeah, it won't work for you because you look too good already. So we're
Right.
not talking about you doing this on Tamron Hall or Jennifer
Hmm.
Ashton or Kelly Ripa. We're talking somebody who hasn't been taking great care of their skin, but they're also not like horribly sun damaged and stuff like that.
Yeah, yes, exactly. So I'll give you kind of a rundown of how I approach that patient. Most likely at this age and stage of life, they're going to be more of a dry skin type. Usually, that's what I see.
Mm-hmm.
We use a system in our office called the Skin Type Solution, and basically they take a big quiz and it gives them one of 16 different skin types, which is really just, are they dry or oily? Are they resistant or sensitive? Are they pigmented or non-pigmented? And that means hyperpigmentation that they want to improve, not their skin tone. Are they
Mm-hmm.
wrinkle prone or tight? And so based on those 4 parameters, we get 16 different variations. So
Hmm.
I already have that information, which most of the time is something I could tell just by talking to them.
Mm-hmm.
But it helps me kind of discern exactly what's going on. And then based on their concerns, which you already said. So for her, she definitely needs to be on a retinoid, right? In this case, I would
Okay, no, let's
probably.
start every morning. She's okay.
Okay, look,
I
we're
get up
starting
in the
from the beginning.
morning.
Not
I
most
get out of
important. We're
bed.
starting from the beginning. Okay.
Yes, I get out of
So,
bed. What do I do with my skin?
okay, so in this case, I really like a cleanser that has a gentle exfoliant in it. And the reason is because I rarely put my patients on leave-on exfoliants because I'm
Mm-hmm.
already going to be putting them on a retinoid and I don't want to overload their skin and make them more sensitive. So with the cleanser, they can really lather it on the skin. I say leave it on for 30 to 60 seconds, let it give you a little bit of the softening effect, and then you can rinse it off. So
Mm-hmm.
for her, I would do like a 10% moisturizing glycolic one. Replenix makes a really nice one that I use for a lot of my dry skin patients.
Okay.
Glycolic is my favorite chemical exfoliant for dry skin. So wash with that, and let's keep it simple. Let's say
Yep.
she's not really interested in using an eye cream, so we're going to go straight to an antioxidant. A vitamin C is the gold standard. I love L-ascorbic acid, but I also love THD ascorbate for my sensitive patients.
Mm-hmm.
Let's say she's not super sensitive, I would probably put her on SkinCeutical C Ferulic. That's one of my favorites.
Yeah, you can't go wrong.
Yeah,
It's
it's
just it's
just
expensive as heck. That's the
it
only
is.
problem.
Exactly,
Okay,
it
so let's
is.
say she's like, oh my gosh, this is $180 for 1 ounce. Do you have a less expensive option?
Yes, so I do like the Dr. Dennis Gross. He has a L-ascorbic and a lactic acid combined, that I think is a little less than half the cost. So still
Okay.
not cheap, but
Mm-hmm.
L-ascorbic acid is difficult to formulate, difficult to stabilize. So I always recommend investing in that product
Okay. And
specifically.
she's like, hey, that's a great option. I'm saving half
Yeah,
the cost. Let's go with that.
yeah,
Okay,
and
so she
I really hate using the word dupe, especially in this case because it's a
yeah,
great product in its own right. It doesn't need to
yeah.
be a dupe of anything, but it's just a great option. It's really, really good. So then
Okay.
I'm going to go to moisturizer. My favorite moisturizer for dry skin, especially mature skin, is a moisturizer called Xerophyte Barrier Repair. And
Hmm.
it uses something called MLE technology. So basically, when you look at the structure of the lipids underneath the microscope of that moisturizer, it perfectly mimics the lamellar structure of our own lipids in our skin barrier. So I find that one to be super helpful. It's one I have like my mom, my aunt, everybody on. When my skin starts to flare and I have to go back to the basics, it's always the one I reach for.
Hmm.
Um, so I'll do that for a moisturizer, and then I really recommend a tinted sunscreen for anybody who has any sort of hyperpigmentation issues. So
Hmm.
like a nice tinted sunscreen. I like the Elta MD Elements. It's like a really
Hmm.
moisturizing tinted sunscreen, but as you know, the best sunscreen is the one you're going to wear. So
Yeah,
I'll usually let my patients sample a few before they leave and kind of
yeah.
see what's best for them.
Okay, so she's like, okay, this sounds great. It's easy. You've got the cleanser, you've got the antioxidant serum, you've got a moisturizer, and then you apply the sunscreen afterwards. Now, how about her nighttime routine?
So for nighttime, I do recommend double cleansing, and that's only because if you're wearing enough sunscreen, which you should be, especially if you're trying to treat photo aging, it's going to require more than one cleanse to get it off, especially tinted sunscreen. It's just
Hmm.
difficult to remove. So like an oil cleanser first or an oil balm. I love the PCA Skin oil cleanser. I love the Naturium balm. It's in a little purple jar, and it's very inexpensive, fragrance free. It's like a pleasure to use.
Hmm.
And then a gentle cleanser after. So I recommend keeping your active cleanser just to once a day. So in her case, it's the glycolic cleanser. At night, just a nice gentle cleanser. And my rule of thumb for skin types is if you're on the oilier side, you want something that comes out gel or foaming. If you're on the dry side, you want something that comes out milky or creamy, just because
Exactly.
that they often contain those extra lipids to kind of deposit on our skin. They won't strip the skin. So some of my favorites, I love the VMV Red Better Creamy Cleanser. I love the Skin Fix. It's called a foaming oil cleanser, but it's not foaming in the true sense. It's just the like the actual pump that makes it kind of foam a little bit when it comes out.
Okay.
Those are great options for dry skin.
Okay.
And
So
then,
then she's cleansed, and next step.
yes. So for me, I keep it pretty simple with just a retinoid and moisturizer, but depending on which retinoid I give them, will kind of the order will change. So my patients who I'm putting on a prescription, which in her case I probably would see if she was interested in a prescription tretinoin for the photo aging, because
Mhm.
it's she's going to get the best bang for her buck. In that case, I would do the moisturizer first, and then a pea-sized amount of the retinoid, put it all over just until she gets used to it. I would
Mhm.
have her start every 3 nights for a couple weeks, then slowly work her way up to every other night. The goal is to get to every night, but we kind of work our way up there slowly.
Would you use 0.05% or what percent
I really
would you
like
use?
Altrino, the
Okay.
0.05%. It's a brand name. It's
Yeah.
a nice lotion formulation. That's a great one. So I or 0.06 retin-A micro, but I start
Okay.
on the lower end.
And then anything else after that, or just end with the retinoid?
I just say end there, especially if
Okay.
she's someone who hasn't used much in the past.
So that's nice. I mean, that's a very simple and effective skincare routine. I would give that my stamp of approval as well. It's very similar to one that I have in my book. We call it the 2 minutes, 5 years younger skincare routine. I think all this is based off science. It works. It's
Yeah.
easy,
And
and
they're going to see results, and that's the most
exactly,
important thing.
exactly. Okay, so we talked a little bit about skincare. I'd like to ask you a couple of things as far as like what you're excited about in skincare before we go into injectables. So, what are some of the things, the trends in skincare products that you're excited about coming into this new year of 2024?
That's tough. I think we always start to see kind of the Sephora and Ulta brands start to pick up on things that the quote unquote medical grade have been doing for a while. So I'm
Hmm.
excited to see what they pick up.
Hmm.
We're already seeing them incorporating peptides and things like that at Sephora, which is
Hmm.
exciting. You know, it's a little bit more we're more accessible for the consumer. Not
Hmm.
everybody can see their derm or go to a med spa to get a brand like that. So that's exciting. I also think we're going to start seeing, we did a little bit last year, but we're going to start seeing a pushback on overexfoliation, on using too much. You know, people are going to kind of go back to the basics. I've also seen a lot of talk of like ceramides and moisturizers at the big box beauty retailers, which is exciting to me because we know how important they are.
Hmm.
So I think overall we're going to see kind of a less is more approach for sure. And I think we're going to start to see some of those peptides and other ingredients from the medical grade brands start to trickle into the big box beauty stores.
Do you think that moisturizers are essential for everybody?
I do. I
Yeah.
do. Even my oily skin patients, I put on like an oil free moisturizer because we know that the oil in your skin doesn't necessarily moisturize it. What I will say is that many of the hydration serums out there now, which so many people are using, have emollients and other moisturizers in them. So no product now is just like strictly this or strictly that. There's so much
Hmm.
hybrid in between them because everybody's trying to top each other in the industry. So I
Hmm.
think, you know, if you're using like the one that comes to mind is like the Summer Fridays Dream Oasis. It's their hydration serum, but it's actually quite moisturizing. So I think in that case, for oily skin types, if they're using something like that, they probably don't need a traditional moisturizer. The other thing is most sunscreens are also moisturizers now too. So I don't think everyone needs a strict moisturizer, but I think everybody benefits from moisturizing properties in their routine.
Have you tried any of the sunscreens coming out of other countries like Korea?
I have tried some. I have bought a bunch from Stylovana, and I couldn't tell you the names of the specific brands. I
Hmm.
think Isntree is one that I love. I really love their sunscreens, but they have a bunch of different kinds. The one I used was in like a green bottle, if that's helpful at all, but I loved it. I just think they're like so superior, and I'm hoping that we start to get some of that technology and some of those filters.
Yeah, what's going on with sunscreens here in the United States for our listeners is that the FDA has approved only a limited number of them. And the last one that was approved like 10 years ago or something
Yeah.
like that. And so there are other countries where they have so many more sunscreens. And when you look at overall beauty products, a lot of people believe that South Korea that they kind of lead the charge with being on the cutting edge of beauty products. And so a
Yeah.
lot of people now are going to Korea and they are getting their sunscreens there and bringing them back. Now, to my understanding, it would be against the law to sell those products here, but it's not necessarily against. It's not like a Cuban cigar back in the day where you
Right.
can't bring it back and get arrested. You can get it there and come back. And my family originates from South Korea. We actually visited there a year ago, and I didn't even think about this. And so I came home, and we were at these beauty places all the time because my daughter and my sister and my wife wanted to go to them. And I didn't bother looking at any of it. And now I'm like, oh my gosh, I'm so dumb. I should have grabbed a bunch of them and come back and tried them.
Yeah.
My fear always when you're getting sunscreen elsewhere is, if you don't know what the actual active ingredient is, you haven't used it before. The question is how effective is it?
Mm-hmm.
And that's always the fear. But they say in Korea they've got some of the best ones. So I'm excited to look more into that. I think that it's definitely an untapped market here in the U.S. of actually having sun. It's like you can apply a moisturizer on your skin and not think about it for the rest of the day and just know your skin feels comfortable. But for a lot of people, they apply sunscreen and they are always feeling reminded of it because it's not the same feeling,
Yeah,
or even like the
absolutely.
smell, that kind of classic sunscreen smell.
Yeah, I think South Korea is so advanced in every aspect of the beauty industry, especially the skin industry and injectables and things like that. I would love to go just for the sole purpose of like being a tourist in that area and seeing all of the innovation. I think it must be so cool.
Well, if you ever go, Seoul, Korea is very easy to get around, even if you don't speak or read Korean, because everything's in English there too. It's when you
That's
get
what I've heard.
outside of Seoul that it can be a
Yeah.
whole other deal.
Yeah.
Okay, so let's kind of shift over a little bit, and let's say you've got somebody who's taking good care of their skin. At what point do you recommend somebody that at-home skincare just isn't enough for them? Like, how do they know that they need more than just at-home skincare?
I think that's different for everybody, and I approach every patient differently. You almost have to be a little bit of a mind reader for the person in the chair in front of you and just know you can start to feel what they're going to be open to and what they're not. And if there's one thing I'm not, it's a salesperson. I don't like it. It makes me feel very cringy. I
Hmm.
don't like to sell my patients on anything. And so even if I believe it would be super beneficial for them, it's sometimes hard for me to like get into that conversation if I feel like there's going to be resistance because I just don't ever want anyone to feel like they're being sold something in my
Hmm.
office. I just hate that.
Yeah.
So, depending on, usually there's some inclination from the patient that they feel like they're ready for something else. And
Hmm.
then I'll start to talk about options. And while I'm talking about them, I can kind of see in their face what they're open to and what they're not. Some people, it's like Botox is, the gateway drug and it's like an easy in and everyone's happy to do it. Other people are like, no needles, only lasers. You just have to kind of figure out what they like. But as we mentioned earlier, I think Botox is just a really easy way to kind of get your feet wet. It's one of my favorites when I have, this is one time I will recommend it because I've personally been there.
Hmm.
When I have a new mom in the room and she's just like, I don't recognize who I see in the mirror anymore. I feel like I've
Hmm.
aged 10 years. It's like
Yeah.
such an emotional time. And you haven't been able to really give yourself any of the self care that you're used to while you've been pregnant. Then I'll say, I think if we do just a little bit of Botox, just sprinkle around a little bit, I think it's just going to make you feel more awake. It's going to make you feel more like yourself. It's going to make you feel more alive. And it's always worked. And I can say that to them because it worked for me. So I know that feeling of feeling like you're not yourself anymore. And that just, your skin needs that little bit of pick me up because it's not getting the 8 hours of sleep anymore.
So Botox is a neurotoxin. It blocks the transmission of nerve impulses to muscles. And so
Mhm.
basically certain muscles of the face that create wrinkles by basically contracting, it can essentially weaken those muscles for 3 to 4 months or so, and those wrinkles essentially smooth out. Now, Amy, are there any parts of the face that you like to start out with let's say this patient you're talking about? They're Botox naive, they've never had it before. Where do you recommend that they kind of start if they're a bit nervous?
Yeah, I will tell you, I almost never inject the crow's feet on a first time patient. And the reason I
Interesting.
tell them is because these lines on your forehead and the 11s between your eyebrows are really more angry lines. They're made from expressions of anger, confusion, things like that. Where the lines around our eyes are happy lines. They're lines that are made from smiling. And I think sometimes if you try to do too much at once, if someone's not really bothered by them, I don't push it.
Mhm.
So I will always recommend usually the 11s and the forehead lines. as a good place to start. And not for everybody, not everyone's a good candidate for those areas, but if they are, I just think it's a really nice way to kind of freshen up, awaken the face. Sometimes what I will do is put a little tiny bit of Botox at the tail of the brow without treating the rest of the crow's feet, just to give them a
Mm-hmm.
little micro lift if they're feeling like their eyes are feeling heavy or something like that. But
Mm-hmm.
crow's feet, I'll usually say, I'll bring it up at a later treatment. I usually don't push it on the first one because it can be a little bit jarring if you're used to having lines there your whole life. And then all of a sudden your entire top third of your face is frozen, because everyone does, the beginning, those first 2 weeks when the Botox kicks in, it's strong and it can be a little jarring for your first time.
Yeah, I tend to be a little different than you in that the area of the face that I avoid on the first time is the forehead, just because it can really impact the shape of the brows. And
Yeah,
sometimes it's
so
a
true.
great impact, and sometimes it's unexpected for them. And so if I get people who are Botox naive, I think like you, I would start with the frown lines. We call it the glabella, that
Hmm.
the 11 sign, those frown lines between the brows. I think that's kind of a no-brainer, a good place to start. Although I'm not too concerned about the crow's feet, but definitely for me, it's the forehead that I
Yeah.
really caution people, and especially if you're like real nervous and you got those patients
Yes.
who are going to be, they're going to get it, and then like 20 times a day, they're going to be looking at their face really carefully in the mirror. That could not go well if they've
Yeah.
not had it in the forehead before.
I think that's very fair. That's an area that I educate a lot on before I
Yes.
inject. I talk about the way the muscle works and what its job is, and that we're going to be quote unquote paralyzing it and what that's going to do to your face, because I just want people to understand. I tell them how it's going to feel the first few days, all those things, because it can be very jarring for someone. I think people come in and they think my wrinkles are going to be gone, but I'm still going to they don't understand that there's that give and take of, well, yeah, you can no longer raise your eyebrows like you used to be
Yeah,
able to, which is exactly how
exactly.
it works. But it can be a little bit scary for some people.
Well, and you get injectors who aren't, as they're not as, I guess, paying attention as much, and they kind of do the same thing on everybody. And you can get some, even though you're not going to get necessarily a quote unquote complication, but if you've got somebody with real elevated eyebrows and you inject a ton of Botox in their forehead, next thing you know, their eyebrows are flat and
Yep.
horizontal, and it changes their appearance
Yes.
so much that I think you got to be so careful up there.
It's an art. It's truly an art. You have to look at every
Really.
patient differently.
Exactly. And you have to treat every patient differently based off of what their anatomy looks like. And I
Yep.
think that's the challenge of new injectors is that, yeah, you can follow where they have, like on your lectures, they say, oh, inject in these places. But if you do that in the same person and everybody the same way, then you're going to get some good results, some bad results, and some kind of so-so.
Yes, exactly.
So Botox is just one of the neurotoxins on the market. There are other ones as well. Would love to hear your thoughts if you use any of the other ones. There's Jeuveau, there's Dysport, there's the new Daxxify.
Hmm.
Have you had experience with any of these other injections and other botulinum toxins? And if so, what are your thoughts on them?
Yeah, so we try to carry everything just so that we have the option for the patient. I would say we say Botox because it's the brand name, just like we say Band-Aid to mean all the other Band-Aids. But I actually almost always use Dysport, and not because I prefer it. I kind of like to explain to the patient they're very similar. I used to say Coke versus Pepsi, but I'm not in Ohio anymore, and I'm in Miami, so now I say Pellegrino versus Perrier because everyone's like, I don't drink soda. So I kind of explain it that way, and that they're very similar. It's really preference. I like to leave it up to the patient. And at our office, our Botox is a little bit more expensive and our Dysport's a little bit less expensive. And because most of my patient population are people my age, they're younger, they're, a little bit more conscious about the money that they're spending. I
Yeah.
always say, for me, it's the same. I will inject you. It won't change the way I inject you. I would go with Dysport if I were you, just because it's less expensive for you. Um, I have had some experience with Daxxify, not a ton. I find that there is a little bit of resistance to using it, I think, because people, I think, are nervous about the duration thing, especially since it's a little bit new. I have one patient who loves Youn for whatever reason, so we can
Mm-hmm.
keep it in stock for her. Jeuveau we used a lot when it first came out, but we haven't really used it a ton since. Um, it's just a lot of different tools in the tool belt. The one
Yeah.
area, lower face, I do like to try to stick to Botox when possible, just because I feel like our dilution is a little bit tighter in our office,
Mm-hmm.
so I'm more comfortable with it when I'm
Mm-hmm.
working around the mouth and things like that, where I really don't want any diffusion.
Yeah. We use a lot of Botox. I'd say probably about 70% we do is Botox, and
Hmm.
about 25% maybe Dysport. There's a question of whether Dysport may create a little bit of a softer appearance, whether it may
Right.
spread a touch more. I do think that that's probably the case. And some people like the Botox look and some people like the Dysport look.
Hmm.
I too, like you, used a lot of Jeuveau initially. I'm actually an investor in the company,
Oh, cool.
but I stopped using it because I didn't see some of the results that we were looking for as far as longevity, which I'm sure didn't make the other investors happy when an investor stops using a product that they partially own.
Yeah.
Yeah, so we don't really use that. I've never really used Xeomin much. And then we are using Daxify and seeing some good longevity with it. But like you, we've been seeing, some people are just kind of, I thought that there'd be more uptake of the Daxify, but I think people are not, they're okay coming in every 4 months to get their injections
I
versus
really
six.
thought so
Like,
too. I thought it was going to be like a slam dunk. Everyone was going to
yeah.
want it, but I just don't, people aren't motivated.
And I bought stock in the company a long time ago because I was like, hey, this is great. I mean, who doesn't want a longer lasting Botox? And now the stock is down like 75% or something like that. So I'm like, oh, well, maybe people don't want a longer lasting
Yeah,
Botox.
it's
It
very
is what it is.
interesting. But I just want to highlight your integrity there for a minute on the Jeuveau thing, because not many injectors would do that. So
Yeah,
that's
our
really cool.
patients didn't really love it. And I was on their advisory board and this stuff, and I felt bad. But in the end, it's like if patients aren't happy with it,
Yep,
I'm
it's
not
the
going to
most
encourage them to
important.
use it. So,
Yeah.
how about fillers? Do you do a lot of fillers? And if so, what are your thoughts lately with the controversy about how long do fillers last?
Yeah.
So just to kind of set the stage, there has been a lot of talk recently. Some surgeons basically saying that, well, fillers may last in the face longer than you think. We think, oh, you inject it, it lasts 6 months, a year, maybe 2 years, depending on the filler. And now people are finding that maybe it lasts a lot longer. And does it potentially increase your risk of surgical complications? Do you have any thoughts on any of that?
Yeah, so I do use filler. I wouldn't say a lot. I think I have a younger patient population, and I have a
Hmm.
very specific aesthetic from my patients. I think they want a very natural look. So I do a good amount of filler, but it's not by far. Botox
Yeah.
outweighs that by far.
Yeah. Oh, yeah.
But I do believe it stays in the face a lot longer than what we initially thought.
Hmm.
Um, I don't remember who it was. It was a plastic surgeon, I want to say out of the UK or Australia, that I was reading about. This has been 3 or 4 years now, and they were talking about MRI studies that they were doing over there and
Hmm.
seeing filler in the face after 10-15 years of the last injection. So very interesting. Is it there enough to make any sort of a cosmetic difference that you're going to be able to see with the eye? I don't know.
Hmm.
But I can't speak to the surgical complications part of it, but I can say that it's something I've been moving more and more away from. There's a time and a place for it, and there are some things that only filler can do. But in my career now, I am so much more likely to recommend somebody go see a surgeon than I was 5 years ago. I think I'm more comfortable with the idea of it.
Hmm.
I remember when I first started, there were some other injectors at the office who their thought was, well, if you do this now and you do it forever, you never have to have a facelift. And I remember kind of buying into that for a little bit and now being like, yeah, no, that's not how that works at all. So if there's somebody, I'm very honest with my patients if I think they're going to get a result that they're looking for. And there are people who argue, yeah, if you do 15 syringes over a couple of visits, they'll get a similar effect. And their patients buy into that. And I'm like, yeah, one syringe is
Yeah.
about the size of a blueberry. You're not going to be making much of a difference in someone who's really a surgical candidate. So I'm very open about that with my patients. But overall, I do find myself leaning more towards devices. Um, I still use filler, but just not like I used to.
Yeah, yeah, and I think really with filler, it's unfortunately as plastic surgeons, I think are guilty of it maybe more than anybody else because we tend to, if there's a little of something is a good thing, we tend to then think, oh, well, then a lot has got to be a better thing, and so you can see that with BBLs, you can see that with breast implants, you can see it with, you know, facelifts where you're pulling the skin tighter and tighter, and all these procedures that we're kind of overdoing. I think filler is a great option, but you have to use it ideally sparingly,
Hmm.
conservatively. I do think that there are some people who do have filler that can last a really long time, especially in those parts of the face that are really um, that really just don't move. So if
Yes.
you inject filler in the nose, if you inject it over the cheeks,
Hmm.
if you inject it into the chin, these are areas that really the metabolic rate potentially in that area is not as high versus you inject somebody's lips and 6 months
Yes.
later it's gone. But I also think that you probably can get buildup of scar tissue too. That's the other thing is that you keep injecting over and over again. And I've seen some patients where you inject filler in the lips and eventually either the filler stays or it's just scar tissue eventually that just stays and adds volume there, which can be a good or bad thing depending on if you like the result or not.
Exactly, depending on how it all pans out at the end.
Yeah, so I think just like you said, I think it's important to just be very cognizant that fillers are just another tool. They don't lift anything. They basically just create some softening and filling out. And if that's what you're looking for, then by all means.
I think they're
So
great for refining too,
yeah,
especially I have a lot of patients who do end up doing surgery, and then it's just a really great way to refine places
mhm,
that still need a little bit of volume.
totally agree. Okay, so I'm going to ask you for some quick takes on some viral skin treatments. And you can pass if you're like, oh, I haven't seen this one, because I'm always on social media, as you probably know. So I know this stuff, but I can't expect that you're going to know all of them. But if you do, that's great. So some quick takes on viral skin treatments. First one is mewing. What do you think
Mewing?
about
What is
mewing?
mewing? Oh no, the first
Oh,
one I
okay.
don't know. What
Oh,
is it?
sorry. Okay, so there are these groups of typically it's men, and usually they're kind of like incel men that who claim that um, if you
Oh, I have
elevate
seen
your
this.
neckline, so basically lifting your tongue to the roof of your mouth, and you do that repeatedly, it's going to give you a sharper neckline. And that's called mewing. Now, a lot of people will elevate their tongue to the roof of their mouth and they take a photo because it makes it
Yes.
look lifted. I mean, it's crazy when I do it,
Yeah.
so it's like
Yeah.
crazy how. But then there are people who believe that if you do that regularly, that's going to essentially snatch your jawline.
I don't think that would work, right? Because if you're strengthening, I'm thinking of like if you're strengthening like the platysmal bands, you're going to actually have more pull forward, right? That's how I think of it. You're going to have an undesired effect.
Yeah, I just can't imagine that that's going to change anatomically
Right.
something that's droopy, essentially. So I
Right.
don't know. It doesn't make sense to me. Okay, well, we'll skip over that. How about snail slime moisturizers?
So this is one I get asked about all the time. And I actually have a lot of colleagues who are obsessed with it as well. So I kind of was like, okay, what is all the hype on this snail slime stuff? And I think, it's a good hydrator, it's a good moisturizer. There's some other ingredients in there. There's like glycolic acid and there are some peptides and HA, but for me, it's a really nice moisturizer. I don't see the benefit of more than that.
Yeah, yeah. All right, there was a video you may or may not have seen of somebody combining flaxseed with water and putting it all over her face as a flaxseed mask. Have you seen that
I
video?
have seen it and I think that's so silly.
Okay. How about doing masks from at-home ingredients in general?
I don't think that you're gonna well, to be honest, masks in general, I don't think you're gonna see much of a difference just by way unless you're using it every single day. But I don't see the point. I'd rather eat the food. I'd rather get the antioxidants orally than put them on my face.
What do you think about red light therapy?
I love red light therapy. I think, again, I do think the research is a little bit young, but I do think for me, there's enough evidence for me to use it and recommend it to put my money behind one of those masks. I think it's great for inflammation, for boosting collagen. It's not going to be life-changing results. I think it's once you've already got your skincare absolutely on point and you're not ready to maybe try something further than that, it's a good kind of in between to add to your routine. But I personally use it every day.
One of the things that I have resolved, and I told my wife last night, she went to go pick up my daughter from dance class. And when she left, so I have been dealing with a little bit of thinning hair. So I've got a laser helmet, an
Hmm.
Iristor laser helmet,
Yeah.
and I use it like every other night and wear it. And my kids make fun of me. And so I'm like, you know what I'm going to start doing now? Is I'm going to put my laser helmet on for 25 minutes. I'm going to put my red light mask on for 10 because it's set for 10 minutes. And during those 10 minutes, I'm going to meditate. And I'm like, this is going to be my wellness, like the thing I'm going to
Yeah.
start doing. And you know that they're going to see this and it's going to be so ridiculous of
Mhm.
dad wearing a laser helmet, a laser mask, and sitting there meditating. But I'm going to see. I think I'm going to stick with it. I'm hoping that I do.
It's so funny you say that because I actually wear the helmet from Current Body. They have a helmet. I wear the face mask and the neck and chest mask all at once. It's all a
Oh,
10-minute treatment,
oh, there
and
you
their
go.
helmet has headphones in it, so I can put my
Oh,
YouTube meditation into the helmet itself. It's
oh.
it's the most
Well, I've got the
absurd
Current Body
sight.
mask, but then I've got
Yeah,
the Iris Store helmet.
yeah,
So.
yeah. So I have all three on, and I do exactly that.
So you have a podcast. So I'm talking here with Amy Koberling. She's a cosmetic dermatology PA. She's got a podcast called #Skinenthusiast. I was very fortunate to be a guest on several weeks ago, And it's really, there's not a lot of podcasts on skincare or care of your skin in general. So this is one definitely I encourage everybody to listen to. But I'd like to ask you, um, you've interviewed a lot of people on your podcast, myself excluded. Who are some of your favorite guests that you've had on your podcast? And maybe what have you learned that you were surprised to learn from any of your guests?
Oh my gosh, I have had so many incredible guests, yourself included. I think it is hard because a lot of them are in the exact same field as me. So
Mhm.
just like our conversation was very aligned, many times it's already things that I already know and I'm already educating. But some like standout episodes for me were Dr. Samantha Ellis. She's just so eloquent in the way that she delivers information.
Mhm.
And she has a new brand called Prequel that I absolutely love.
Hmm.
Susan Yara's episode is really good. I think she has just been in the game for so long. She has tried
Mhm.
so many different things. It's really, really cool to hear from her, like what she's done in the past. She was kind of the first one actually who got me to try collagen because
Hmm.
she was one of the first people I interviewed. And I had still been on the fence and I hadn't heard about the most recent meta analysis that came out, I think in 23. And she's the one who brought it to my attention and said, I'm now using collagen because of all this information I've learned. And she's the one who actually convinced me. So I would say that's a pretty big change to my routine after years of really kind of
Yeah.
being on the fence about it and not being willing to invest in it. She convinced me to try it.
So my guest today is Amy Koberling. She is a cosmetic dermatology PA. She's got this podcast called #Skinthusiast. Would definitely encourage you to take a listen to it. She is very active on Instagram, and her name is Amy Koberling. It's just basically all one word, Koberling. We'll have a link in the podcast notes as well. But before we finish today, I'd love to ask you to give one final tip of advice to our listeners, whether it be skin or anything related. What would you like our listeners to leave with?
I'm sure everyone says this, but wear your sunscreen. Wear your sunscreen and reapply because the prevention is worth so much more than the correction you're going to have to do in the future. Wear your sunscreen.
Great advice. Well, thank you so much for joining me today. I appreciate it, Amy.
Thank you so much for having me. This was fun.
And thank you, everybody, so much for listening. If you've been enjoying this podcast, if you could leave a rating or review on iTunes, it definitely helps me spread the word. And remember, as always, my name is Dr. Anthony Youn. I'm known as America's Holistic Plastic Surgeon. This is the Holistic Plastic Surgery Show. And always eat real food, use clean skincare, and autojuvenate before you operate.